This nursing mindset is about autism and ADHD. In healthcare, it's easy to focus on a diagnosis like autism or ADHD. But here's the nursing mindset. Great nurses don't treat diagnoses, they care for individual children. Every child has different strengths, different challenges, and different needs. Our job is to recognize those differences and adapt our care to help every child be successful. So let's look at what that means. We're going to start by talking about Autism Spectrum Disorder, or ASD. Children with Autism Spectrum Disorder often experience differences in communication, social interaction, and sensory processing. One child may avoid eye contact, another may become overwhelmed by bright lights or loud noises, another may communicate very little but understand everything happening around them. That's why we never assume every child with autism needs the same approach. Instead, we individualize our care. One of the best resources you have is the child's parents or caregivers. They know the child's routines, their triggers, and communication style. They also know what helps them feel safe. As nurses, we can also reduce unnecessary sensory stimulation by lowering noise levels, limiting interruptions, and keeping routines as consistent as possible. When communicating, use calm, simple language and give one direction at a time. Before touching the child or beginning a procedure, explain what you're going to do and allow time for the child to process that information. And remember, safety is always a priority. Some children may wander, become overwhelmed, or have difficulty communicating when they're frightened or uncomfortable. Now let's move in and talk about ADHD. Children with ADHD often struggle with attention, impulsivity, and hyperactivity. One thing I always remind students is this. Children with ADHD usually know what they're supposed to do. They often have a difficulty consistently doing it. That's why our nursing care focuses on creating an environment that sets the child up for success. We can reduce distractions, give one instruction at a time, and break larger tasks into smaller, manageable steps. Positive reinforcement is far more effective than repeatedly pointing out mistakes. We also want to collaborate with families, teachers, and other healthcare professionals because consistency across home, school, and healthcare settings leads to the best outcomes. Let's talk about ADHD medication safety. Behavioral strategies are important, but many children with ADHD also benefit from medication therapy. The most common medications are central nervous system stimulants, such as methylphenidate or Ritalin, and amphetamine, dextroamphetamine, or what we call Adderall. These medications increase dopamine and norepinephrine, helping to improve attention while reducing hyperactivity and impulsivity. Some children may instead receive the non-stimulant atomoxetine, or what we call Strattera, which works by selectively increasing norepinephrine. Regardless of which medication is prescribed, nurses have several important responsibilities. We monitor height and weight because stimulant medications can suppress appetite and affect growth over time. We assess blood pressure and heart rate, monitor sleep patterns, and watch for changes in mood or behavior. Patients and family teaching is equally important. Stimulant medications should generally be given before breakfast and lunch to reduce insomnia later in the day. Families should avoid giving caffeine and should always check over-the-counter medications because some contain stimulant ingredients that can increase side effects. Finally, remind families not to stop medications abruptly without consulting their healthcare provider and to report any concerns about side effects or changes in behavior. So let's put this all together. Although autism spectrum disorder and ADHD are different conditions, our overall nursing approach is remarkably similar. We individualize care. We partner with families. We promote safety. We communicate effectively. And we evaluate whether our interventions are helping the child be successful. I'd like to leave you with one final thought. Instead of asking, what's wrong with this child? Ask, what does this child need to be successful? That simple change in perspective transforms the way we communicate, teach, and provide care. When we recognize each child's unique strengths, adapt our nursing care, and collaborate with families and the healthcare team, we're not just managing a diagnosis, we're helping children reach their greatest potential. Keep working to develop your nursing mindset.